Associate Professor and Information Services Librarian at the Library of the Health Sciences in Chicago. And welcome to overview of literature review types. In addition to myself, I have my colleague Amelia Brunskill, who will be monitoring questions today and also will be sharing some links with you along the way. This webinar is going to be recorded, and as long as you registered for this, you will receive the recording, and also you will receive a PDF version of the slides too. So you'll be receiving all those. And if you have questions along the way, you can put them in the Q&A section of the webinar. I think in the bottom of the screen, I think you'll see something for Q&A. And I'll take a couple breaks along the way just to check in with questions. And if something more urgent comes up, I guess, Millie, you can let me know if something comes up that I need to clarify or something like that. So I think what I'm going to try to do, and hopefully you'll be able to see this poll that I'm putting up right now. And I just wanted to get an idea of just to see how many of, in terms of how many colleges you're from here, just so that I can see, just so I can get an idea of the participants today. And I see so far in terms of the responses that are coming in, I think actually a good, most of you have actually worked on a systematic review before so far. Um, so it looks like we have some people here with experience. So I'm just going to give it another minute or so that we can see. I think most people have filled it out. Okay, so I'm just going to end the poll right now just so that we can get an idea of, so it looks like we have a good mix from other colleges here, which is great. And we have a lot of people here, faculty or students, and I like, actually most of you have worked on a systematic review. So thanks for, just wanted to get an idea for today. So in terms of what I'm going to be covering, it is what is the best review type to answer a research question that you have? What is a systematic review? What are some common review methodologies? And I'm not going to go through all of them, I'm just highlighting a few, and the strengths and limitations of each type. And lastly, UIC Library's role in supporting reviews. And the one thing that I'm going to bring up a couple times today as I'm going along is for this webinar, want to stress that there's no superior review method. Instead, it's more about choosing which review is best going to address your question. So I'm going to start off with is what is the best approach for your question in terms of trying to determine that. So I have a quote here from an article that I'm going to mention to you in another minute or so. And I'm just including this here on the screen as a reminder that no matter what review you're doing, this is just important to keep in the back of your mind that that no matter how rigorous it is, you still have to be systematic with that review in terms of the process. And there has been an explosion of systematic reviews over the last 20 years. I mean, I've been a librarian for 20 years, and I don't think I really started getting questions about this until the last 7 years or so. And there's also been over the years that systematic reviews are assumed to be methodologically superior and less prone to bias than traditional narrative reviews due to rigorous and reproducible methods. However, systematic review is just one type of literature review that can be done, and not all questions are suited to be answered with systematic review methods. They each have their own strengths and weaknesses. So it's just something I want you to just to keep in the back of your mind as we're going along here. And this article is just sharing this with you. It's a really good article because I didn't know that when I read this article, there's actually, I think, over 40 different kinds of review articles that were out there, because I know there was an article that came out, 2009, I think it was. There's like an article typology of reviews, and this, I think there were only 14, and this one says there's over 40, and there's probably more since this article came out. It does link to published guidance about review articles, these kinds of review articles. The only thing with this is that this was published before PRISMA was updated in 2020, the PRISMA reporting guidelines or standards for that. And there might even be additional articles or documentation that have come out since this article is published, because they do have a supplementary document that has a table and lists all sorts of things there. Like in terms of, what are the standards and the recommended articles to take a look at. So those might have been updated along the way. And I put on the next slide here is a mnemonic for something called retreat. And this might be helpful for you in thinking about the kind of review you're doing. And in terms of the first letter, which R for the review question, is your review going to be descriptive, aggregative, or interpretive? Is the data required to answer the question quantitative, qualitative, or a mixture of both? So you're going to be matching the specific question to the most appropriate type of literature review method. And then the next letter, E, epistemology. Hopefully I'm saying that right. Not a word I have to say every day. It's your view of the knowledge, the branch of philosophy concerned with knowledge, and recognizing assumptions about that knowledge and what is for that that underpins the different review types. The T is for time for constructing the review, and I think this is or conducting the review. And this is really important because I frequently will run into people who think, oh, okay, it's only going to take me a few months to screen the articles or build the search, and sometimes it can take way longer, especially with the screening process. So that's just something to keep in mind. How much time are you actually going to have to do the review? And then the next letter for R for resource constraints. You have access to the databases you need or the tools that you need to conduct appraisal or analysis. E is for the expertise requirements. For example, do you need a librarian help with this? Someone with experience with statistics, if you're doing a meta-analysis, or if you're doing more of a qualitative analysis, somebody who's experienced with coding. And then someone, let's see, and then the A is the audience, who's the intended purpose of the article. Is it educators? Is it clinicians? And the types of T, the last T there is the types of data, the richness of the data. What data is out there? Can you actually be able to do the kind of study that you're interested in based on the data that you're able to find or looking for? And then there's a couple tools that might also be helpful for you to figuring out what kind of review article that you should be doing. And the first one is Predictor. It's a tool for estimating how long a review is going to take. It calculates the time requirements for various tasks involved in reviewing evidence, from planning and coordination to quantitative synthesis and reporting. The next tool is Write Review. It used to be known as something else. They changed the name recently. So it's what you would do when you go on it. I think you pick quantitative or qualitative, and then it guides you through. You have to answer questions to see what kind of review they're recommending. They are going to be adding mixed methods as an option because right now it's just the qualitative and quantitative. So I was pleased to see that they're going to be adding mixed methods there. So now I've given you a couple ideas or resources that will help you to start thinking about what kind of review or things to keep in mind. I'm just going to spend a few minutes going into what a systematic review actually is. And a systematic review is a summary of research results, and it uses explicit and reproducible methods to systematically search and critically appraise and synthesize on a specific issue. And here I italicized at the bottom there, minimize bias, because that is a really very important thing with the systematic review to keep in the back of your mind as you're minimizing the bias piece with that. So the methods are explicit, transparent, it's comprehensive, and also reproducible. And then you're following an established structured method to locate the critically appraise and do and synthesize all those articles that you're finding. And these are terms of some more things to think about when you're boiling this down. These are the common elements of a systematic review. They seek to answer a narrow question, include a process called critical appraisal, and this to evaluate the included studies, search both scholarly and maybe even gray literature, and involve analysis of the synthesized study results. The synthesis can be quantitative, but sometimes could be narrative, which is getting more into like a meta synthesis. And these are some of the major review method, like standards and guidelines. that some of these you'll recognize. I'm sure Cochrane's probably the one that's most familiar to you. There's Joanna Briggs. And then there's also Prisma, which is more for actually reporting out your search strategy and how you're doing the data analysis and components like that. And there we are going to have in April, I think it's the first 2 Thursdays in April, we will have one webinar is going to go over Prisma, what that is, and there's another one that goes into not all of these that you're seeing here, but it's going to go over the major ones for reporting out your searches or in terms of the methodological reviews or expectations of that. And then in terms of here we have, and you're going to see slides like this as I'm going along, covering the different kinds of reviews, as those narrowly focused questions that you would be asking for systematic review. These are best aligned with this review type and usually fit into the PICO framework, which is, I think some of you are familiar, patient population, intervention, comparison, and outcome. Another framework is, I think it's PEO here, which stands for population exposure and outcome. So we have an example here of a PICO question that you could be asking for a systematic review. Does the use of prophylactic probiotics in combination with antibiotics prevent surgical site infection more effectively than antibiotics alone in colorectal surgery patients? And then I have this this very pretty slide here, a picture of a lighthouse, and this is from a book chapter that they use this like a lighthouse as an analogy here. The systematic review method is similar to the beam of light from a lighthouse. They cast a powerful beam that illuminates the intended area of study, but leaves the rest of the ocean in the dark. So that's just as a way to think about what a systematic review is. And then in terms of strengths and weaknesses here, or limitations, that it's very comprehensive, trying to reduce bias, and is considered to be the gold standard for many reviews, but it can take a very long time to work on one of these. And you might, since you're being very narrow in terms of your focus, that there might be other articles or related areas you might have to leave out from the analysis. So systematic reviews are a very focused review type. And then here's an example from an abstract of a systematic review. And I just highlighted a couple words here so that you can just see, just to get an idea of that. So just wanted to show you that. And I'll be showing some other examples of some other reviews as I'm going along. And then in terms of when this systematic review methodology, when it doesn't apply, so how should you proceed when a systematic review is the right method? But you still want to conduct a literature search. And as you see there, this is going beyond, like you instead of focusing on a single issue, you want to explore different issues. You want to see what's out there. So these are some examples or times when you might have to go broader or think about another kind of review article to do that what systematic review might not be able to cover all that. So before I get into just some of the common review types, I just wanted to check and see if there are any questions so far.
There aren't any in the chat so far.
Okay, thank you. And if there's questions, please, put them in the QA. We'll do our best to answer questions today. So the first type is probably one you're probably really familiar with, is a narrative review. And what they do is that they identify key information relevant to a topic, assess the status or quality of existing research, critically examine support for alternative theories or arguments, and evaluate research methods used in previous studies. It's really helpful for selecting suitable research methods, assisting in the formulation of or evaluation of policies, programs, or services. So this is a very, you can kind of go in any direction you want with a narrative review. And they're also, you might see them be called purposive or thematic too. So on this slide, we have an example of a mind map or concept map, which shows how a single topic has many different interrelated aspects, and conducting a narrative review allows you to delve into many of these aspects, including context theory, multiple interventions, etc. So to paint a complex picture for your audience, in the center of the screen, we have the research topic in that, I don't know what color you would call that, a beigey yellow box there. There are other boxes linking to related areas such as effects and outcomes, interventions, theoretical underpinnings, socioeconomic context, and population of interest. And then you keep going more specific there. So this is just an idea of how to think about that literature review or your narrative review. And these are like in terms of the questions, it's very broad, as you see from the example on the slides, very broad question. How has policy influenced the built environment over the past 100 years? That can very broad, lots of literature that you can cover there. And then if we can revisit the metaphor of the systematic review as a lighthouse a few minutes ago, Cook describes the narrative or purposive review as more of a floodlight illuminating a large area immediately near the source, but missing possibly important regions that lie farther away. So that's just a way to think about like what a narrative review would do. And then this, a strength for a narrative review is that it can give you the current state of research or experts on a topic, but the limitations are the level of evidence is not as high compared to what we saw for the systematic review. There's also a greater chance of bias, and the search methods may not be reported out consistently. So that's something just to keep in mind. And it's yeah, and they, as I mentioned earlier, they each have strengths and weaknesses, these kinds of reviews. So just thought I'd mention that. It's not inferior, it's just a different way to go about to get to what you need. And here's an example of a literature review, and highlighted here, the abstract presents a review of such solutions, including both early review studies and individual case studies. So this is just to give you an idea of that narrative review example. So the next one here is, I don't actually see a lot of these, and I wish I saw more of these as I've been going along, scanning citations when I've been meeting with students or faculty. And this is a systematized or a structured literature review. And they usually include how you conduct the search for your review article. Attempts to include elements of the systematic review process without meeting all the standards for a systematic review. And it may be more appropriate for an individual project, such as a postgraduate student assignment. And this is appropriate for a student project because it introduces you how to be systematic in your whole searching process. But the limitation is that they don't have like any sort of standards. From what I know, I haven't seen any standards lately about how you would actually conduct one of these. There's no Prisma for this in terms of reporting this, what you should be reporting out. So here's an example of a systematized review. And as you see in the words that are bold, the review was conducted as part of the author's master's in public health coursework. Okay. So the next few slides, like 6-7 slides, are going to be focusing on mapping and scoping reviews. And I will say it does get murky with what these kinds of reviews are, because sometimes people will use scoping and mapping interchangeably. But there is a difference between them. I don't think it's a huge difference, but there is a difference between them. They're in the same family of articles. As I think the article Amelia will be sharing with you, it's like this. I think they're calling them the big picture reviews is the category of these. So a mapping review, it maps out and categorizes existing literature from which to commission further reviews and or primary research by identifying those gaps. It's a systematic approach to understanding the map of profession, theory, research, question, or practice. And as you see here, it might be called these several different things. You might see these as mapping reviews. So this example here, or analogy, I took from a book by Booth and a few of his co-authors. It's a systematic approaches to successful literature review. And because it helped me to better understand what a mapping review is, especially compared to a scoping review. And a mapping review is like a magnetic compass. You drop it down the center of your topic and assess the lay of the land in each direction. Which directions look to be most productive and which look like a possible dead end. So it's looking out there. It's trying to see, okay, what's out there? It's just looking around and seeing what's there. And I will say, unfortunately, that Booth book is only in print. There's only, I think when I last checked, there's less than 10 copies available in iShare. So we have 2 copies that are at UIC Library. Once I think is checked out. We couldn't get an ebook version of that, but I found this book very helpful. So mapping reviews can identify subtopics that are already covered in literature and helps you to summarize what is already known and enables you to identify gaps that you might target with your own research. So have an example here. I think I took this example from Booth's book. What are the main types of papers? Because I think I filled in the words, which I hope makes sense, on or what he wanted on using virtual reality in undergraduate nursing education and where are the major research gaps. Like, so as you see, this is a broad question. And then we get into scoping reviews, which you might be more familiar with. And they identify boundaries, parameters, gaps, and they're putting the literature in buckets. And according to author last name of Munn, scoping review seeks to explore and define conceptual and logistic boundaries around a particular topic with a view to informing a future predetermined systematic review or primary research. So you might, when you do one of these articles, you might see, oh, you know what, we actually would have enough to do a systematic review. Sometimes I think most cases, from what I know of the faculty that I worked with, they're not always doing an actual systematic review after they do a scoping review. But in next week's webinar for the systematic review series, there is a webinar that's going to focus on scoping reviews if you wanted to know more about those. And again, this is from Booth's book. A scoping review is like a geometric compass. You pinpoint the central focus of your topic, and then you look at the implications of changing the radius of your compass so you can adjust that scoping review. What is the scope? How far? How broad do you want it to go? So just to think about that, because I think mapping is more what's actually out there, and this is like you can actually adjust it, the parameters more just to see that scope. And then in terms of the type of question, what research, again, this is a broad question, what research exists on school-based mental health interventions. So it helps you determine which elements of your topic that you can focus your energies on. And you're also getting a feel of the quantity and quality of the literature that's available in your topic. And it might help you to figure out which direction you want to go. And helps you to decide whether you'll be able to manage the quantity of literature within your available time and resources, whether you need to revise your plans. So that's just to give you an idea of a scoping review. Again, is very close to what a mapping review is. And I just put together here the 2 scoping and mapping reviews in terms of their strengths and limitations. They're less restrictive than a systematic review, but they can take almost as long, and that you're not usually doing an appraisal or any assessment of the studies. And it's also recommended that if there is a systematic review out there, that's not necessary to do scoping review, because if you were to have a systematic review, why do the scoping review in the same topic? Okay. And then here's an example of a mapping study that I highlighted here, what they were talking about here. Carbon farming contracts. Conducting a systematic mapping review of articles that they extracted from different databases. And here's a scoping review, examines and summarizes the characteristics of research related to mental health screenings or referrals to treatment dental practices. So I think I have maybe 2 or 3 more kinds of reviews to go. So before I get into those, I just wanted to check in and see if there were any questions.
None in the chat or the Q&A, but we can give people a second or two if anybody's typing. Not seeing any.
Oh, all right, thank you. And next we have rapid reviews, which are done when components of the systematic review process are simplified or omitted to produce information in a short period of time. So the rapid reviews tend to be more focused. They're like how a systematic review would be. I guess like the process is kind of the same. And this on the slide, you'll see an example question here that we have about comparing two types of medications here. So in terms of the strengths, it's you're getting this article done in a shorter timeline. But because this is used more for evaluating like a new or an emerging research topic, because I've had a couple times people say, I'll just do a rapid review because I just want to get it over. I don't want you to think of a rapid review as a shortcut. It just there's a certain time like COVID is an example because I know there were a lot of rapid reviews because everyone's trying to figure out how is COVID-19 working, how to in terms of treatments, and trying to go into literature and figuring all this out on the fly. And those rapid reviews that's what a lot of people were doing, those just so they could get the evidence, the existing evidence out there. And there is, it's not as rigorous though as a systematic review. Even though you might be using the same databases, it's not as rigorous, and there might be more bias in it too. And here's an example here, because I mentioned with COVID-19, because there are a lot of rapid reviews that needed to be done about that. And as you see in that, the words that are highlighted there, they were searching up to April of 2020 at that point. So as they're trying to get, looking around, trying to get the research out for people, because it was such a time that you're trying to find the evidence, on the fly, just trying to figure things out. And then the next one is because I recognize a few, because I work with nurses, so I recognize a few of you out there. Integrative reviews, and this is more, it's more in the nursing literature. I haven't seen many examples in other fields. And these include qualitative and quantitative studies and have a structured literature search. And the strengths is that you can include different types of evidence with it, but in terms of the limitations, you can't always do an evaluation of that, and I think for the most part it is focused mostly in the nursing field. So I think it could work in other fields too. But that's just in terms of what the limitations are. And here's an example of an integrative review that was conducted. And they actually looked in like several different databases here. And then the realist review or realist synthesis. And it's answers the question, what works for whom, under which circumstances, rather than what actually works. So that's just a slightly different way to think about this. Is what works for whom in a particular situation. And it's good for complex interventions or programs, looking at how they're working or not working in particular contexts and settings. So we have an example of a question here. What mechanisms are triggered by better interventions and programs, if any? And do they have successful outcomes? And it's well suited for complex interventions. But the limitations is that it requires a strong methodological expertise from the reviewer. And here's an example of an realist review. It's in terms of the words that are highlighted here. And then the last one I'll review is the umbrella review. And this is sometimes called a review of reviews. And what you're doing is usually you're synthesizing and combining relevant data from existing systematic reviews or meta-analyses to make better decisions, or provide evidence when there are too many systematic reviews to keep up with for interventions. So when you're using this is when you're synthesizing and combining relevant data from existing systematic reviews or meta-analyses to make better decisions, but you might have limited evidence sources, and it's impossible to do an umbrella review without without actually having systematic reviews on the topic. And here's an example of an umbrella review here. So they're having systematic reviews with or without meta-analyses. So they're actually looking at those. Didn't matter if they did those or not with the meta-analysis piece. And again, just want you to remember, it is not necessary to do a systematic review to conduct a review whose methods are rigorous, comprehensive, and reproducible. Describe your methods clearly, justify your choices, and aim for transparency. Okay. And now I'm going to get into just to show you the actual support that the library provides for reviews. And what I'm going to do now is I'm going to flip back to I'm on the library website, and I'm going to show you the systematic reviews guide that we have. So I'm on the guides right now, clicking on that guides link, and then I can type in systematic reviews. And I'm just clicking on this first one right here. And for those of you who are not health sciences, I would still, even though it says health sciences here, I would totally look at this because I think this is the only guide that we have that focuses on systematic reviews, and I think you'll find this helpful. So on this guide, we get into information on librarian support. So I'll go over that in another minute. But the links for resources that we have here, we have some recorded webinars from a couple years ago, and I know there's probably going to be more being added from the series that we'll be doing. And then we have a Zotero library that has readings on review methodologies. I was asking to see if a few citations could be added to that, like that Booth book that I mentioned a little while ago. So I highly recommend looking at this just so that, to get an idea of the kinds of review. We don't have examples of everything, but we have like articles that get into overviews or methodologies and things like that. So that's something I wanted to show you and I think Amelia's sharing in the guide. She's sharing the link to the systematic reviews guide there. And then we also have links about Covidence too and other things. And it's also might be hopefully somewhere along the way you'll consult with the librarian about systematic reviews, and if you don't know who the librarian is for your department or for your college, I'm going to up to contact us, and then you can go to the library directory. And then when you go to the library directory, then you can look at the subject librarians, and then you can see who's the librarian who is assigned to your college or department. So they might, just in terms of if you're not sure who they are, that's how you find them. Okay, I'm just gonna skip ahead here. And in terms of what, just how a librarian can help you, is that we usually will meet a couple times, once or twice with the review team. We can help you to think out your search, to kind of get you started, how to brainstorming about your search strategy, guidance on different pieces of the search. So these are some ideas here. And then usually in this case that the librarian would be acknowledged in the paper, hopefully when it's published, or the methods section that you worked with the librarian. Librarians can also co-author too, but in some cases we can't. depends on how busy we're. So it's if it's going to be a lot more work, like in terms of we're building out the strategies for all the databases that you're using, and that might be when you start thinking considering us as a co-author. But that guide that I just showed you has information about that. And then I just went over about how we can help you on the library website about how to find information about who your librarian is for your department or your college. So, and then this is, let's see, I have my contact information here. And as I mentioned a few minutes ago, that the scoping reviews one is the next one. And there's a very short evaluation for you to fill out. But I just wanted to see at this point if there were any questions. I know I covered a lot of information, but yeah, just let me know if there's questions at all about something I didn't cover or covered, or hopefully I will do my best to get you an answer to your question.
None yet, but a lot of great content. Maybe I'll go ahead and stop the recording at this point.